legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, May 3rd. I'm Brent Anir with TMA. Turning the corner, rounding third, or in the home stretch, however you wish to put it, we've crossed into the final month of this legislative session. The last day is May 27th. So this week we're focusing on where we are and what work remains. For example, did you know that a deadline looms for the House to pass bills on to the Senate? To explain that and other key points on where we stand this session in TMA's efforts to stand up for patient care, here are TMA's Vice President of Communications, Steve Levine, and Vice President of Advocacy, Darren Whitehurst.
So we've got 24 days left until the legislative session must end, and we've got a lot to get done in these last 3+ weeks, but we're in really good shape, and we're going to kind of use this time between Darren and I to talk about some of the things you learned back in government class and how that applies to what we're trying to do for doctors. We're going to go through each of the items on TMA's legislative agenda and sort of see where our key bills are and what deadlines they're up against.
Wonderful.
Let's start with graduate medical education. There's a significant amount of more money for GME and more residency slots in the budget. The budget bills are in conference committee. Want to tell us what that means and where we go from there?
Well, both the House and the Senate have appointed conferees on the budget. They've had some preliminary discussions. They will be meeting over the next several weeks. Bottom line as far as the deadlines, they've got to have a conference committee report adopted on the 26th. All conference committee reports have to be adopted, but you go back even before then on when you got to distribute amendments, got to get them out in a timely manner. So probably talking that the week of the 19th is when you'll see those budget bills show up in their respective chambers to be voted on. And between now and the week of the 19th, those conferees will be working on finalizing the differences between the two budgets.
Well, there's another bill related to GME, Senate Bill 143. That bill has already passed the Senate, and now it's waiting for a House committee hearing. What's going on between the House and Senate right now?
Well, right now, you always get into a phase of session, sort of a tit-for-tat phase, is that the Senate has passed bills out of their chamber, House has passed bills out of their chamber, and you want to make sure that there's sort of an equalized number that are getting referred, that are getting heard, and both chambers complain that not enough of their bills are getting heard. So the last calendar for House bills, the last general calendar for House bills have to be distributed to members by May the 7th. The last calendar is actually May the 9th on the general calendar for all House bills, and if you're not on that calendar on the 9th, your bill, unless you're on the local calendar, which have different rules, but basically you're dead after the 9th of May.
So the House can only consider bills that have already passed the Senate by that point. Anything that's brand new in the House by the 9th of May is done.
Well, the bills that are originating in the House. On the Senate bills, the Senate has until actually the 19th is when all Senate bills have to be on a House calendar and actually have to be heard by the 21st or they're dead. So we still worry about amendments and other things that, a bill that dies could actually show up in a resuscitated state as an amendment onto another bill. So we have to be real careful about, captions on bills, the clauses on the bills, the statutes that are opened in bills, to make sure that, if we have a bill that dies, we're going to be looking for opportunities to put those on as amendments to pieces of legislation. But you also have that on the bad side, is that your opponents can be looking for those same opportunities.
So you're going to be watching those bills that could possibly be vehicles for the dead, so to speak.
That's right. Absolutely.
Well, let's talk about, for example, a bill that has passed the Senate and it's on House Calendars Committee. So we're waiting for the House to schedule it. That's our delegated practice bill, Senate Bill 406, which brings a whole new approach to the scope of practice issue. Really allows physicians to work in a much more modern sense with advanced practice nurses and physician assistants.
Right.
So that bill has passed the Senate.
Right.
It had a House committee hearing, and now it's pending in Calendars Committee.
Right.
What does that mean?
Well, basically, for this next week until I gave you that deadline of the 9th, they're going to be hearing primarily House bills.
So this is a Senate bill, so it's not going to get out of Calendars Committee for the next week.
That is most likely true. There are always exceptions, but my guess is it'll show up on a calendar after the 9th. I think the focus is going to be on House bills at this point in time, and we actually had a bill that passed earlier that the House bill and Senate bill lined up on the calendar's process, and they substituted. It was a House bill that was on the calendar. They substituted the Senate bill that it was its companion, and then basically heard the Senate bill. And so that bill has passed. Senate Bill 945, which related to the identification of personnel in the hospitals. That basically you have to identify who you are. So if you have those sort of synchronizations that happen, then you can substitute the Senate bill for the House bill. But again, is that all they're likely going to be posting, or primarily what they're going to be posting on the general calendar for the next week, is going to be House bills, and then they'll go to Senate bills. So I think that one, the delegated practice, basically team-based care, is going to show up on a calendar after the 9th.
After the 9th. And let's get back to the budget for a little bit. Earlier this week, TMA President Michael Spear sent a letter to the Budget Conference Committee members saying, hey, it's time to, if you want to fix Medicaid, because everybody keeps talking about how it's broken, if you want to fix Medicaid, the most important thing you can do is raise the payment rates to physicians to Medicare rates so more doctors will participate. How does a request like that play out in the conference committee?
Well, it's sort of a hit or miss type of deal. If you catch them in the right framework, then I think that there's potential opportunity there. The challenge is going to be several days ago they had a discussion about water and funding a water plan for the state of Texas that will cost about $2 billion. The bill was killed on a point of order. It's going to go back. It's going back through the process, and it's going to come back up sometime before the 9th. And so we'll have further discussion about it. But there's real concern is if they don't get the rainy day funds necessary to fund that water program, they'll be looking at the budget because I think that most legislators believe is finding $2 billion to fund that water plan is an essential element. So I think that we're going to have a difficult time anyway, just based upon the amount of money that's being put into Medicaid right now. But
asking for more money at a time when perhaps water might be sucking some of that money out would make it more difficult.
That's right. You're going to be competing with water for that funding. The legislature will have some money, I think, to be looking at in conference, and we could have something like Medicaid, we could have something like graduate medical education. Might pop up, and we might have an opportunity to put a little bit more money than the legislature's already put in. But you have competing interests like water and transportation and education, all competing for those same limited dollars.
Well, you got a little bit more than 3 weeks left. Darren and his team are going to be watching all of these bills with hawk eyes, the ones we're trying to pass, the ones we're trying to make sure they don't pass, as he said, the ones that might be vehicles for the dead. So they're definitely going to be earning their pay for the next couple weeks as if they haven't for the past 3 months. And hopefully we'll have some more good news to bring you soon. Thank you, Darren.
Thank you. Hope to see you at First Tuesday. Thanks.
Thank you both. Have you planned your Austin trip yet?
Tuesday. First Tuesday.
Tuesday, May 7th is the final installment of TMA's First Tuesdays at the Capitol this session. It's your last chance to join your TMA family for a group legislative visit, and we need your help to push through those bills that Darren and Steve just discussed. So help TMA help you care for patients in this time of change. For info, visit textmed.org/firsttuesdays. Who knows, your patient story just might be the one that sways a vote on behalf of patients and medicine. I've heard it before, and it could happen again. That's it for now. I'm Brent Anir. Thanks for watching, and please join us again next week for TMA's Legislative News Hotline. See you then.